About a week ago, Bob was trying to give his friend some advice for shoulder pain.
That's right. And after thinking about it very, very intuitively, Bob decided I should tell him not what to do with it, but what he should not do to the shoulder.
So if you're dealing with shoulder pain, we're going to go over the biggest mistake and things you should avoid and how to fix it.
Right. And things can get better much faster.
Bob and Brad, the two most famous physical therapists on the internet.
Hello, I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course.
And if you're new to our channel, please subscribe.
There you go. Subscribe once or twice, actually, one way or another.
So the biggest mistake most people are making is that they are not supporting their shoulder enough when it is bothering them, and this is commonly due to depressed scapula.
Yeah, so take it to the psychiatrist and see if you can lift its spirits.
Yeah.
I'm just kidding. Actually, here we go. Look at this. Today is a good day to have a good day.
Did you hear that?
And that's what we want to do with the scapular. Let's get serious. We'll show you exactly what we're talking about.
So Brad is going to show on me.
Right. Now, what we do in the clinic, we have someone take their shirt off or whatever so we can see the scapula, and you compare one side to the other, and almost always the painful shoulder, the scapula, is dropped down visibly compared to the opposite. So if we look at this scapula here, it'll actually drop down up to 1 inch or so. Now, what we want to do is get it back up. What that does is it changes the mechanics of the shoulder, allows the muscles to get tight and irritated up here. Not only shoulder pain, but neck pain and even headaches can be caused as a result of this. So if we can get the shoulder blade back up, then the pain goes away. And we're going to show you 3 simple ways that this can be done. Very good. How was that, Mike?
That was great. My shoulder is so much happier now.
There you go. We've undepressed it.
So the biggest mistake is to not support your shoulder when you are standing, seated, or resting, laying down. Oftentimes your shoulder, when you're just sitting, can sag and pull on it even more. So what we want to do is just elevate it and give it some relaxation, take some tension out of those muscles, and that's what Bob had his friend do.
Allow me to clarify. The reason it gets sagged, one of the reasons is the weight of the arm pulls it down. So if we take the weight of the arm off, allows it to go up. There we go. And we'll put a pillow in there. There we go. But now this is one of those things you're working at your computer workstation. If you have armrests and a nice chair like this, oftentimes there's buttons on them. Oh, now these are nice. They go forward, backwards, rotate, and up and down. So you'll want to adjust those so that when they're up high enough, so when you're working here, I can feel the weight off my shoulders. I can feel these muscles much more relaxed compared to if I'm like this. So that's one thing. If you do not have adjustable armrests, you go to your bedroom, pull out a head pillow, fold it like this. There we go. And you feel better already. Actually, you want to put it in here, and you're going to actually make, can I get another one? You'll probably want it to do it to both sides. These are actually very comfortable because they're soft. They do the job of taking the weight off of the shoulders, and it works quite well. The only problem is if this works really well consistently, and you don't want to do this every time, you may want to consider buying a chair that does have elevating armrests.
Now, if you're on a computer for numerous hours a day and you're like some people and just sit on your couch, your recliner, or at the island on the bar stool, you're not going to get that support for your shoulder, and it's just going to keep bothering you. So you have to get a nice optimal setup somewhere in your house where you're at least in a chair with your arms supported, because it's not going to go away.
Yeah. Now, if you do have armrests that don't go up and down and you don't want to use a pillow and you'd rather not spend a couple $100 on a chair, you take some foam like this and you cut it with a knife very carefully and safely, and you duct tape it right to there.
Just like Bob did.
Bob has that on his chair right now as we're watching him. He's shaking his head yes. He's got one of these. He's got blue cushions duct taped to each armrest, and it's made a world of difference with his shoulder pain. So there's always ways to be creative. Okay, let's go to number 2.
So tip number 2 is just throughout your house, whenever you're seated or going in different positions, just make sure, again, you bring a little throw pillow or normal pillow. So if you're on your couch, in your recliner, another chair, just make sure it is nice and supported. If you are eating at the table, you can try resting your arm on the table itself. It might feel a little awkward, but at least you're not having shoulder pain, which is the benefit of it.
Especially if you were taught from your parents as a child, don't eat with your elbows on the table, then you're going to have to, it justifies that that's okay.
Yeah, we'll allow it now. And the last tip is for sleeping. Again, we want to support it. We're going to need some pillows here.
Yeah, we got some. Yeah, this is a big one. I've had many patients I've worked with on that, and pretty much every therapist has. I still deal with it with myself.
For camera purposes, we're just going to switch to my left side, but you want to support your shoulder again. So in different positions, if I'm lying on my back.
Lying, Mike.
Lying.
We have English majors that are watching.
Try to support it with a pillow. You can do a throw pillow. You can do a large pillow.
You can use 2.
You can use 2 pillows. You might get a little warm with 2 pillows, but just see what feels best for you. Some people like to get it more in their armpit. Some people more out here. Just having it nice and supported like that. If you are lying on your side, what we would recommend is the painful side be up top. So we're going to switch to my right side is painful now. And again, make sure you have the right amount of pillows between your shoulder and your bed there. And just take a pillow. You can fold one. You can grab 2 pillows. I would need another one to put right there.
I'm going to take one from your head.
Fine.
We'll pretend that that's okay.
So that's another way to support your shoulder. Now, if you absolutely...
Wait. I just want to say, I want to make an amendment here.
What?
This can make tremendous... I've had more success with people doing this. They say, oh, does that feel good on my shoulder? And you'll be more comfortable there and less likely to roll around when you sleep as well. But I think Mike has another scenario that is common.
Sometimes people really can't sleep on their other side for whatever reason. Maybe it's back pain, hip pain, etc.
Because they've been sleeping on the painful side for the last 30 years.
So what you can do is, again, you're going to want a couple pillows up top. You're going to make a little canal. You're going to place this other pillow roughly around your rib cage. And then you can sleep on it like this. If it's still painful, try to roll back kind of like a 45-degree angle, and there'll be less stress on your shoulder.
Can I say what I always say, Mike?
Sure.
So one thing I do, if this isn't working out for someone, and they'll go ahead, lie down, and if you just slide that whole shoulder so you get that little twist, you're still on your side, but it really takes a lot of pressure off that shoulder joint. Try that and see if that works. Personally, that's what I do, and it works.
If you happen to be a stomach sleeper, just try not to put your sore shoulder over your head like this, because this is probably just going to bother it more. So you're going to have to try to go to the other side and just let it relax. I can't do it with my microphone right now, but just, yeah.
The stomach sleeping is a challenging one. We're not a big proponent.
I'm a challenging one. I do all the positions when I sleep.
Good, Mike. Good. All right. So what's the next thing we want to talk about? Work with those. Avoid things that irritate the shoulder is the big thing. Outside of this, if reaching up into the cupboard always hurts, you're going to have to reach with the other hand. One thing that just as an addendum again, if you reach up and it hurts like this, bring your hand in like this and reach up like this. Sometimes that will reposition the joint, allowing that motion to be pain-free. Then go ahead, take the time to do that. It's one of those little tricks that us therapists give out.
So try this initially. If you want to work on some stretches or strengthening exercises, you can click the video link on the screen. Again, this video kind of addresses the similar problem of a depressed shoulder blade, and this can hopefully give you some more long-term fix once your pain subsides.
There you go. I think we got a lot of good information for not irritating your shoulder pain, allowing it to get better through.
Get a lot of pillows.
There you go. Yeah, do get a few pillows. That's important. All right, very good. Once again, we can fix anything except for a
broken heart.
Broken heart right there, but we're working on it. We'll continue to do it with.
Maybe pillows can help with that too.
No, that won't help. All right, take care.
Pop and Brad.